discussing about the workflow of ArogyaShree. Workflow of ArogyaShree we will be discussing here. So basically the ArogyaShree is divided into two parts. One is for the primary healthcare centers or clinics, and another is for users. So we will be discussing what will be there for the primary healthcare centers or clinics and what will be there for the users. So first discussing about the primary healthcare centers. There will be so basically first let's discuss the idea how ArogyaShree works. Like first basically when a person enters our website, he will be getting a login authentication. After login authentication, he will be getting a dashboard. In the backend, he will be allocated a separate database in which his previous health reports, previous health conditions, and what all medications they have taken till now. These all will be stored in the database allocated to that user. He can access only when his user credentials are like this is the primary idea. And after that, what will the primary healthcare centers have? Primary healthcare centers have the read access to reports, plus access to our chatbot, which can summarize the reports. And uh, we are trying to connect IoT devices such as smartwatches to this website so that they can get the real-time data. In the dashboard, they will be getting the real-time data monitoring plus visualization. And the third point was uh, we will be having a feedback mechanism like user experience and doctor experience we will be getting, and we will be improving according to their suggestions, etc. The fourth one was time series forecasting. As we are collecting the real-time data, like if we get the past thing, we can try to get the future thing by time series forecasting. This feature might be useful for the patients who are above 80, above 60 to 80, and having some heart diseases. We can monitor those persons' heartbeat, etc., and we can predict the future using a time series forecasting. It can help us to save the person to some extent. So now we will be discussing what all the features the user will have. Like this product is mainly useful for the user. As I discussed, primary health care centers having chat, the user also having chatbots plus reports access. And the second one is like data visualization, uh, time series forecasting, and feedback mechanism are common for user too. And user is having an option, a chatbot, like he's having a model. So basically, I have planned to do something like to train a model. Like initially in government hospitals, we will be having in-out receipt. In that, what the model does is, like in the government hospital, I have observed that they will be giving an in-out sheet, like a medical receipt sheet, like name, age, gender, and what all the problems and what all the tablets are prescribed for them. We can use these sheets and train some models, like especially like we can have 2 to 3 models interface, like one for eye problems, one for ear problems, one for nose problem, one for ENT, and one for chest or heart, and one for lungs, etc. We can have some basic models which can judge, which can give medications, which can give medications for the basic aids, which can able to give the medications for the basic care. So this is the third point, and the fourth point was uh, like this is a basic case. If the person wants to connect with a doctor, he can have online doctor appointments, and after that, fifth one will be uh, these medicines. This will be on board, and the fifth one will be notification of tablets. Notification of tablets. Like if a person gives his email or mobile number, he will be getting the notification that you must take the medicine right now. And another thing was medicine delivery. You can plan for the medicine delivery. Like I think for us the main challenge will be the online doctor appointment and medical delivery, as we have to connect to the nearby people. I think rest of the ideas are fine. Like here in this you might be asking, this might be we will be getting data so that we can do this model part for only eye, ear, ENT, heart. Here what I will do apart from medication means, like I have a domain knowledge of yoga, pranayama and meditation. Apart from giving this tablet suggestion, I will be adding some of the techniques like yoga, pranayama, medication, etc., so that the people will be cured easily. And the main aim of the main aim of our website is to be main aim of our ArogyaShree website is to be it is easy, it can be easily the first one was can run everywhere on lower end devices also it can able to run. Like we will be having local language translation so that our website will be famous very can be famous in a short period, because we will be having some local language translations. This is the idea I want to propose on like this will be the workflow of ArogyaShree. Thank you, sir. So you might be asking, like the model which I have trained, it will generate a receipt. In that, same as mentioned in government hospitals, you will be getting the name, age, problem, and some medications. Like this will also be stored into the database which is connected for the person. So further, like initially, if a person is having a cough, he entered his details to the model. He will get some receipt. The receipt will be stored to the database, and if the medication didn't work well, he will go to the doctor. So when the doctor logins into the system, he can able to see the previous medication which is generated by our ML model. So this is a use case especially I want to include, because the people in the rural areas are not having that much medical facilities and transportation facilities to move from rural villages to urban villages for basic treatment. So in this case, they can use this model as it supports the local language. It also supports the local language translation. It is more helpful for the people who are unable to spend more money to go for the rural areas. Thank you.